In Part 1 and Part 2, we reviewed restrictions on voting rights and why they matter to health professionals and to patients across the nation. In this part, we'll focus on what hospitals and medical schools can do. My name is Rishi Manchanda. I'm the founder of RX Democracy, and I'm joined by Mirna Perez, the Senior Counsel for the Democracy Program at the Brennan Center for Justice at the NYU School of Law.
One of the tools that we can use is the National Voter Registration Act. It's sometimes called the NVRA or Motor Voter. The goal of the NVRA is to make it easier for all Americans to register to vote and to maintain their registration. And it's done this in primarily three ways. One, it creates a federal form such that people can mail in their voter registration forms. They no longer have to appear and present at a supervisor of elections offices. People can also register when they're getting their driver's license, and people can register at public service agencies. There's stuff that we believe that hospitals and healthcare practitioners can do. I know that as a patient, whenever I go see a doctor, I come home with a lot of pieces of paper. I'm given information about what my insurance will and won't cover. I'm given information about my privacy rights. And there is very little stopping a hospital from deciding to also include a state or federal voter registration form that the voter can take home and complete and turn in. Hospitals can also let nonpartisan voter registration drives set up in the lobbies or the waiting rooms or outside to catch people as they're coming or going in the hospital. And a state can also, and the hospital can also indicate that they'd like to be a state voter registration entity under the National Voter Registration Act. It would impose certain requirements, including reporting requirements and offering registration services, but given the amount of people that go through hospitals on a daily basis, this might be a very effective way to reach communities that are otherwise not reached through other means.
We, as in hospital settings and in teaching hospitals specifically, are entry points for millions of Americans, particularly those who experience health and civic disparities. And we know through our experience with RX Democracy and hand in hand with partners like the Brennan Center that clinicians with the right education and the right support, clinicians and students can be effective champions and allies for voter registration. It's that partnership that we think is exceptionally exciting, especially right now, and what has led us to launch America's 2012 Hospital Voter Rights Campaign. The goal of this campaign is to promote hospital-based nonpartisan voter registration drives, and our aim specifically is to mobilize 1,000 health professionals and students in healthcare settings and hospitals specifically to help register voters and partner with nonpartisan civic groups and elected officials to do so. Watch the rest to learn why voting rights matter and how hospitals can get out the vote.